Hello and welcome to Psychology in Seattle. I'm your host, Kirk Honda, professor and licensed therapist. Today I want to talk about trauma treatment. In my experience, most therapists do not know how to treat PTSD or trauma effectively. I know that's quite a statement, but I think it's true. There's evidence, and I could provide research to back me up here. But in this episode, I want to keep it quick and dirty, and so I'm not going to go into the research. But certainly anecdotally, in my experience, and even in my own career, evaluating my own competence, I can say that the skills involved and the knowledge involved in treating people who have experienced trauma are quite complex and, for whatever reason, are not propagated through the culture of psychotherapy and counseling. And as a result, I think a lot of clients are going to therapists and being treated with dubious treatment modalities and walking away without being helped and maybe even being harmed. So in this episode, I want to talk about trauma treatment, not only to you clinicians out there, but also to you non-clinicians, to you potential clients, because I think that for whatever reason in our culture, we haven't talked enough about trauma to help people to seek help from the people that might be able to help them. I think for a lot of people, when they have been traumatized, they are told at some point, you should see a therapist. But what they aren't told, which is what I think they should be told, is you should see a therapist that knows what they're doing, because not all therapists are the same when it comes to treating trauma.
Hey, deserving listeners, I'm chiming in from the future. This is me in 2025. What you've been listening to is an episode from 2014 in which I talked about my approach to trauma therapy and my mistakes as a therapist early on that I learned from. In this episode, I detail pretty comprehensively my approach, my integrated approach to helping people with trauma, PTSD, complex PTSD, personality disorders, etc. And I, go into detail, but I'm also fairly concise in that the episode is only about 45 minutes, which is not common for this podcast for me to be comprehensive and concise. But the full episode is for patrons of the podcast. So if you want to hear this, then become a patron. Otherwise, please take care of yourself because you deserve it. You really, really do.